Hi everybody, welcome to me, Dr. Jima. Do you have any idea what this is? Or that? Or that? Or that? Or that? Let's talk about it. As you can tell, there is a discoloration of the toenail and the fingernail. And this is because of an infection from different kinds of fungus, mold, yeast, and many other. As you can tell, the nail is relatively yellow in color, and sometimes the nail can be brown in color, thick and brittle. This causes a little bit of self-consciousness and a little bit of emotional turmoil for a lot of people. This is not an ominous condition, although it can physically affect how others feel because of how it looks. And sometimes it can also affect how you actually walk because of the pain that you may have when you have these type of presentation. When you have this condition and you see your clinician, most clinicians can give the diagnosis right after looking at it and do not have to do anything else for further investigation. In some cases, they may take a sample of the infected or affected nail and run it under a microscope to identify exactly what type of infection this is. Sometimes they may also take the sample and send it over to the lab and run it for a fungal culture. You may be asking yourself who is at risk of getting this type of infection, and essentially if anybody that has developed athlete's foot or ringworm of the foot, you are at increased risk of getting this. Diabetic patients are actually at increased risk of acquiring this as well. Anybody with poor blood circulation disorders or anybody that is immunocompromised have significant risk of acquiring this infection. If you or anybody you know with this condition may have tried over-the-counter antifungals, unfortunately, you may not have had any success with that. And that is because these topical antifungals have statistically proven not to be effective. If you talk to your primary care provider, they may give you some oral antifungals, which tends to have some improvement, but overall, in the grand scheme of things, are not very effective. Depending on the type of nail that's infected, if it is the fingernail or the toenail, you may have to take these oral antifungals for approximately 6 to 12 weeks respectively. In most cases, people end up taking this for approximately 6 months or 12 months in order to see some significant improvement of the discoloration of the nail. I must note, although there may be some improvement, there is also significant liver damage and also other skin conditions that may be as a result of taking these antifungals. And yes, your clinician may actually prescribe you a medicated nail polish or a medicated nail cream that you can apply to the affected nails for several months in order to see some improvement. Once again, there may be some improvement over a long period of time, but the topicals are relatively much safer than the oral antifungals given the liver implications. There are several approved FDA laser treatments for this type of infection. The idea here is that the infrared radiation from the laser treatment actually increases heat into the affected nail and kills the fungus. But, and a big but, high quality efficacy studies have shown or proven that these type of treatment are less effective as compared to the oral and the topical antifungals. You may not have this type of infection at all, or you may have 1 or 2 nails that may be infected, but the rest of your nails are not infected. And your question probably is, what can I do to prevent spread from the infected nail to the other? Or what can I do to prevent acquiring this type of infection? And I must admit, there are several things that you can actually do to prevent yourself from acquiring this infection. And I want you to start taking some notes if you would like. Always keep your hands and feet clean and dry. Wear absorbent socks. Use antifungal powders. Don't share nail clippers with other people. Don't walk barefooted in public places such as the locker room or public showers. Clip your toenails and fingernails short and straight and keep them clean. Clean any nail grooming tools after each use. Avoid biting or chewing on your nails. Avoid cutting cuticles as it serves as a barrier to prevent infection. Do not rip or bite a hangnail. And when you go in for your manicures and pedicures, try to make sure you go to a place where they sanitize all the tools and equipment they use after each person. At this point, the original question still holds. What is that, and that? And the answer is
onychomycosis. Fungal infection of the nails.
At this point, you may be smiling or giggling, meaning that you did enjoy this video. So do not forget to smash the like button. Do not forget to subscribe. Dr. Jima, I'm out.